So hi everyone, I'm Amy Johnson and I am the director of the Parent-Child Center of Northwestern Counseling and Support Services, one of the Parent-Child Centers as part of the network, and I am located in the northwest part of the state. I get confused sometimes with the map of Vermont, but that's where I am. I am not the only one presenting today. I also have a co-host and a couple of other PCC directors are here, so I might toss some things to them on the fly. So Josh Miller, if you want to introduce yourself.
Sure. Thanks, Amy. Good morning. I'm Josh Miller, the Executive Director of the Janet S. Munt Family Room in the Old North End in Burlington, formerly the VNA Family Room. We've been doing our own thing now for about 5 years. So thank you. Thanks for having us today.
Awesome. So we don't have a ton of time, and the plan for this session is for us to do kind of a brief overview of parent-child centers for folks that aren't familiar. Like I said, there are folks who are very familiar, but some folks who aren't. And we'll kind of noodle along until we get to our legislative ask, and then hopefully we leave some time for questions. Not always good at PowerPoint, and I'm really chatty and I go off on tangents a lot. So you might hear about my work with elephants, completely unrelated, but here we are. So parent-child centers, yay. What's a parent-child center? Well, we'll get to that in a second, but so there's 15 parent-child centers in the network. We are in 12 regions and we serve all families in the state of Vermont. Josh, I'm just gonna let you chime in whenever you want. So otherwise I'll just kind of steamroll. All right, so I know we have one of like the mothers of the Parent-Child Center here on the call, Cheryl Mitchell. And this always gets a little complicated for me because I hear different dates all the time, but I think I've landed in a good place. And Cheryl, you can just give me a thumbs down if this is wrong, but we came to be in the late 70s, early 80s. We were named in Vermont statute. So one of the really cool things to know about parent-child centers, we are family resource centers and we are written into state statute. And that happened in the late 80s. Parent-child centers are family resource centers, and they are a place for families to get the supports that they need, build connections, really focused on that strengthening families' protective factors model. We're responsive, strength-based, and as always, family-centered, and we support families through the multi-generational approach. So we're not just focused on the child, we're thinking about that child within the family, within the greater community, and that whole system, that whole family. So you can see parent-child centers equals results. Yay, RBA. So we have our network mission. We're supporting children, youth, and families. And I already talked about the strength-based holistic approach, and that the network of parent-child centers provides leadership, support, and advocacy to the members to achieve the best outcomes for children and families. And then, so again, a big piece of what we do, if you think about parent-child centers, is we are providing direct services on the ground to families through a variety of different ways. But we're also big advocates, and we push for legislation that supports families and children and is in their best interest. And so we really are that direct service provider and also systems level thinkers and navigators and also advocates. Josh, did I miss anything? We're going rogue? That's me.
No, I think that sounds good. I just gonna say in my head, I was just thinking a little bit about, the difference in parent-child centers. We're all, doing a lot of the same work, and we all look different based on our region. There are 3 of us in Chittenden County, Milton Family Center and Lund in the family room. And, we really are doing a lot of the same work, but that we really focus on the folks that are in our area to best meet their needs. And so I just want to mention that as, you might have places that have different services based on geographically where people are at. So just want to mention that.
Yeah, that's awesome, Josh. We often hear if you've seen one parent-child center, you've seen one parent-child center, and that used to be really talked about in this really negative way. And I say kudos. We have things that tie us all together, but we should all be unique unto our region because each parent-child center is serving different families who have different needs. So if we all looked cookie cutter, that wouldn't make a lot of sense and wouldn't really be doing a just service to the families that we're supporting. So PCCs are a hub in the community. Like I said, we serve pregnant and postpartum families, families with young children. A lot of us have adolescent programming, but we really are seen as that hub in the community, a place where families can go that's welcoming and supportive. And there's targeted supports when families have specific challenges and barriers going on, but also universal access, that it's not specific families, it's all families. And we have do broad prevention work via perinatal supports, play groups. Many of us have therapeutic child care centers, learning together program, that's our pregnant and parenting youth programming that's connected to the education system. So we're really that, if you think about it, that targeted supports, but also the universal access. There's something for everyone. Josh, unmuted. You go, Josh.
Thanks. And I think that just to underscore that a little bit, a couple of things about that come to mind about the universal access of just wherever families are at in what they're working on. It might be ready to have a baby, start their family, might be having a bunch of kiddos and they just need some support. There's just a lot of doors for families to come into the parent-child center, whichever one they're going to. And I just think that's really important, that they find different ways. Might be childcare, might be a play group. And then also just the idea that families of different backgrounds are coming together to get similar services. That it's kind of the playing field is leveled a little bit. We're all trying to work on raising our families in the best way that we possibly can. And it's hard work. We all know that. We all know that in our work. We know that in our personal lives. And I just think that the value of bringing people together with a variety of experiences really make for just a great community. And that's a big piece of what we do, is just having community that it's not just the individual supports for families, but creating a space for families to come together and get the support they need, but also create their own support systems. I think that's a huge value because it's parents and kids and caregivers coming together. I think it's a really cool part of parent-child centers.
Yeah, and I think that responsive nature of parent-child centers, and I'll get into this when we talk about the integrated grant that we all share, is that flexible funding to be able to build the programming that is needed for families. We're really listening to family voice and knowing what is the need. It's not us just saying, we think this is what families need. It's families really telling us this is what we need, and then us creating programming around it. So you can see on the slide that I think I'm still sharing, I talked about the universal and the targeted, and we have some things, supports for vulnerable populations. That's another group that we're working with. And there's a variety of things. And I put etc. because this is not an exhaustive list. And then you can see at the bottom, for fiscal year 21, parent-child served over 59,000 caregivers, children, and youth across the 15 parent-child centers. That number is even bigger if you really look at, a lot of us have food programs, concrete supports programs, and so families aren't necessarily enrolled in the parent-child center. They might drop in and access something from us. So that number is much larger, but in terms of our counts and our surveys and some of the data that we collect, that's the number that we landed on for fiscal year 21. So lots of families supported by parent-child centers. So we talked about, you've seen one parent-child center, you've seen one parent-child center, because that's awesome. But guess what? We're also tied together by our 8 core services. So this is part of our integrated grant. This is named as the work that we do collectively. So the core services, and there's a lot of text here. No, I'm not going to read it all. I'm just going to name them and maybe highlight a few things. And Josh, you chime in. So play groups, this is a big cornerstone of parent-child centers, a place for families to come and to connect, to talk to practitioners if they need, want, and also to gain skill and for children to be able to connect in that social emotional development. Play groups are really magical. When you hear the word play group, some people are like, oh, just like a place where kids hang out and play, but there's so much more to it and families get so much out of it. So that's a big piece of what we do as parent-child centers. Parent support groups. So we have loads of these depending on what's going on for families. We have dad's programs, new parents programs, pregnant programming, and pretty much everything in between. Anything that a family needs, we can develop a group around it. Concrete support, so we know families need help in meeting basic needs. This was really big during the initial phase of the pandemic and ongoing, that we have families that we support, and we saw a huge influx in families that needed the access to concrete supports because families were really struggling to make ends meet or finding things. A lot of the shelves were empty. Diapers, we're the diaper bank for each region. So really making sure to get those basic needs in the hands of families and then helping to connect them to services by way of concrete support access. I'm going to skip around. Parent education. So we have different education courses for families. I'm not going to list it because again, there's everything under the sun that we support parents around to gain the tools that they need to have that they themselves be a healthy, strong family and help their children to have healthy, thriving lives. Information and referral, this is a big one. So we're providing families, like we know what's going on in our region. If we do not provide the service, we can connect families to who does. So we're providing families with information on their children and child development and resources in the area, and also providing direct referrals, warm handoffs / hot hit. This is my favorite, hot handoff, where we're really like, we're bringing you to the place if you need us to bring you there, right? So we're really supporting families to get connected if we are not the place that they need to be connected to. A lot of our programming is through home visiting. That is a huge piece. I have 50 staff at my center. Almost all 50 of them are home visitors. So we meet families where they're at in that natural environment, community, home. It's not always home. A lot of, we have families who say, I'd rather meet at the center, and that's great too, but we do provide that in-home service going right to the family. Early childhood services. So as I said before, sorry, Josh, you unmuted, so I'm gonna pause.
Oh, no, it's okay. I was just waiting. Thanks. A couple things. So I just wanted to underscore the information referral and the hot handoff. I like that. I haven't used that one yet. I'm going to start using it though. But I think that there's something to say, it's kind of a term that you might hear, but it's the importance of that for families and the systems and the resources that are out there. If the family can't access them in the way they need to, it doesn't work. The system doesn't work. The resource doesn't work for them. And it's really important that we help them get what they need and understand the language isn't always that easy. The paperwork isn't always that easy. The phone call is hard to do. You got to press 2 to get to press to 3 to get to 4. And it's really challenging, and you could get lost in that. I know I can. And so families that might struggle with, following all the buttons that they need to press, end up giving up and not getting those services that they really, really need. So just those warm and hot handoffs are valuable, and those partnerships that we have. It's not just, making a phone call with somebody, but we've developed relationships with our partners. And so it makes it a much easier bridge for parents to cross and get to get the help that they need. And then I just will going back to play groups. You're taking the words out of my mouth, Amy, but just thinking about how, it's that door where somebody comes in and, a lot of families, they don't really know what they need sometimes, that they come in and they're like, I need to get out of the house. My kid's driving me nuts. And I need to get to a play group and have my kid go play so I can go pee by myself. Right. And so that's part of it. But then it gets into, hey, here's, I didn't really know that, I needed another mom to talk to or another dad to talk to. I didn't know that, you had supports around helping me out with, helping my kids sign up for summer camp or, childcare. And I think that those things, you know, families just don't know. And I think in this time, when, you know, think of the past couple of years, people who have had babies, maybe even their first baby, are really isolated, and they just don't, they haven't been tuned into the community resources out there. And so to be able to come to a play group and talk to others and say, oh, did you hear about this? Did you hear about that? Is a piece of that. And then my last little piece about that is what's really cool is when a parent comes to a group, whether it be a parent education group or a play group or whatever it is, that they meet other parents. And what's cool is that the parents who've been there for a little bit, they give back to other parents. There's this reciprocation that happens that is, I think, just super awesome. And that families get a chance to do that with other families, and they recognize that family might be having a hard time, and they welcome them and invite them. And it helps to really normalize some of the challenges that parents go through and let them know that they're okay. And I think that those pieces, that social emotional piece that not just our staff are giving, but the community itself, the other parents are doing for others, is really awesome to see. So just wanted to throw that in there.
Thanks, Josh. I was also curious, do parents ever get to use the restroom alone again? I'm just asking for a friend. So thank you, Josh. I'll just list the last two really quickly. Early childhood services. Almost all of the parent-child centers have embedded child care centers. So they're supporting that system by having an amazing 5-star child care center. A few of us don't. Actually, I don't. And Josh, you do not either, although you have a pre-K program. But we support early childhood providers and centers in our region by providing information, support, training, technical assistance. So though we don't have one, we support that system. And then the community development, I saved that one for last, just to note that parent-child center staff and directors are very active in community, regional, and statewide meetings, groups, task forces. Really, again, it's that we're providing that direct service, but also part of those system conversations and making sure that family voice is either directly present or present by way of, you know, us being at the meeting and making sure that voice is there. So that community development piece is really big to the parent-child center and the work that we do. So that's our 8 core services. We all provide those. And that's part of our statute recommendation, is to embed those in there. So just briefly, very quickly, I know ACEs are adverse childhood experiences. And so the CDC, you can see some graphics at the bottom. The CDC's recommendation for mitigating the risk and impact of ACEs is almost directly in line with the 8 core services that we provide. So it's really good to note that the prevention services and early intervention and early identification services that the Parent-Child Center provides are directly in line with the CDC's guidance on mitigating the risk and impact of ACEs. So good stuff. I try to do a Wordle. It's the blurriest thing ever, but I put in all of the great things that parent-child centers do in an exercise that we had done in the past with the parent-child center directors. And you can see all of the great words that came up, blurry as they are, but the big one that you can see that really is just like stands out is prevention. Again, we do so much, and I think people don't always realize that, you know, we're really working with families and we can support them with whatever they might need. So just tons of services and supports for families, really trying to get upstream to support families. And I just want to note, because I'll probably forget or we'll run out of time, because Josh and I love parent-child centers so much. I'm kind of one of those people that has worked in the human services field for a long time, but I job hop because I'm like, oh, okay, this is a great place, but now I'm kind of bored. I have worked for the Parent-Child Center for 5 years now. I love parent-child centers. I don't get paid a ton of money. It's not fortune and fame. I come to these meetings. I like to present about the Parent-Child Center because I really do believe in the work that we do and the value of our work. And I have seen the change in families' lives because of the work that my staff are doing on the ground with families. So I really do think that parent-child centers are magical places that support families. And I will continue to be touting that across the state and the country as much as people will let me. So I think that if this wasn't so blurry, it would highlight all of that. But there it is, our Wordle. That
Yeah, I'll jump in on your Wordle, your blurtle. I think all these things are great, and I think is what parent-child centers, however the diagram might look, but I really do think that it's a lot of our work is working with our families, but that I see CIS on here, and there are a lot of other organizations that we work with of just really connecting the dots for everybody, really being for those agencies, for state agencies, for the hospital, for mental health services. I just feel like we're really trying to pull all that together for families in a way that helps with prevention, is definitely number one on our list, but also that there's part of the intervention too when things are challenging. We're working with state, DCF and Easter Seals. How do we help this family get back on their feet? How do we help them develop, their own network, positive networks of support and education, find a safe place for them to be with their kids. And so we're a part of those plans too. So it's a lot of just connecting things that are in each of our own communities, so that families can, be happy, healthy, successful, think about the ACEs, when you have, worked with a lot of, dads especially, but, we do that. We've done the ACE survey and guys are scoring in 7, 8, 9, and 10. And if we can just, be there to support them, maybe we can reduce that number for their children. And that's part of the cool thing about the 2-generation model, is we're working with parents and kids together to really shift gears, shift that cycle. So I am also, yes, very passionate, excited about parent-child centers. Worked in a couple of them and just love what's happening.
Yay. Well, I'm glad we were able to say that, because I know we're going to run out of time. I have like 1,000 more slides, but so just to note, the Parent-Child Center has adopted the national standards of quality. We are part of the national network of family resource centers called the National Family Support Network. That's a lot of national, as I said national like 8 times in that sentence. But effectively, the National Family Support Network is a network of networks. So every state, not every state, but most states have a network of family resource centers. And we are the identified we're the identified network for our state, and we've kind of opted in to being part of this group. So we're able to get support and technical assistance from other family resource centers around the country. But also the National Family Support Network has developed quality standards for family resource centers. This is kind of taking the tenets of family resource centers, the 9 tenets of family resource centers, and strengthening families' protective factors, and kind of blended them together to create a set of 17 standards in 5 domains. And so we've adopted those standards, embedded them into practice, and it really is around that continuity of care. If families move around across the state, they're going to get high quality programming regardless of which parent-child center they're at. Ensuring that the programming is high quality, that we do have a continuous quality improvement process to make sure that we're doing our best work, we're looking at where we can improve. And then through the standards, there's an annual assessment process that we all go through, and we develop a plan on how to enhance the great work that we're already doing. So the National Family Support Network's well, this isn't their motto, but one of the things that they say is always arriving, never there. And so we're always striving for the highest quality, and we're going to keep doing that in all of the work that we do forever. Just keep striving for the best. So each center has a director who's been trained. I was a trainer. I kind of pulled back from that just from a capacity standpoint, but we still do go around and train different centers on the standards and help them supporting around the annual assessment process. So that is important because we've built that into our statute, is to be part of the standards and have a continuous quality improvement process, which is connected to our peer review, which I'll chat about later. So I'm going to keep going. So I've shamelessly put my child into most of this PowerPoint so that I didn't have to ask for permission from people to put their kids' photos in. So there's my daughter. She's painted as a cardinal. We're at a family event at a farm. So I'm just going to briefly, because again, I have 17,000 more slides, but we're addressing needs through diverse cross-sector partnerships. So it's really important to leverage the family resource centers. They're amazing. We're one of the few states that has them written into statute. Yay, Vermont. So strongly leveraged plus strongly integrated is going to have a huge impact on our state. So just talk about that we are connected. We have strong partnerships at the local level. So schools, mental health. I'm embedded in a mental health agency, the business sector, food shelves, kind of anything connected to children and families. We're connected in our communities. We're very active in the Vermont legislature, and we also are strongly connected to our federal delegation. We have regular communication with our state partners at the Agency of Human Services, Agency of Ed, Department of Health, Department of Children and Families. We connect regularly with the CDD. I know Sheila and Nicole are on this call, and they're great supporters of parent-child centers. Many of us, all of us provide some, no, that's not true. Most of us provide children's integrated services. Many of us are the fiscal agent for that contract. And then many of us provide are the child care referral and financial assistance entity in the community. And if we're not, then we strongly partner with those folks. So again, that it's really important for us. We know that we are really important to the community, and we know that other organizations in our community are just as important, and we need to partner with them to make sure that families are wrapped in the supports that they need. Josh, if you have anything to add, that was kind of a big slide. But then I kind of just put in here, or we put in here, leveraging partnerships for change. And this just lists some creative partnerships and work that we're doing. This, again, is nowhere near an exhaustive list. We do loads of things and have loads of partnerships, but Dulce is one of our partnerships with the pediatric practice. And so we have parent-child center staff embedded in in various practices across the state of Vermont, and they're part of that integrated healthcare team to support families in the first 6 months of a baby's life, which then supports them ongoing. Families learning together, I've already mentioned that. HEART is helping everyone access resources and thrive. That's a perinatal and postpartum program that we developed here in Franklin Grand Isle that's been expanded to some other counties. And I know Josh also has a similar program with a different name. Therapeutic childcare centers, COVID response and recovery, I have a slide on that. Many of us hold a family supportive housing contract. We talked about the standards. We're all the diaper bank. The Kids Apart program is a really wonderful program out of Lund that supports families that are incarcerated or have recently been incarcerated, and supporting family systems that are impacted by by that system. I'm going to turn over to Josh because you unmuted. This works really well.
I just wanted to add, this, it's a good list. And I think that what happens is that there are emerging needs that come up for families, right? So things like this thing called COVID showed up, and we just, really rallied with a lot of different folks, around food distribution, diapers, all that. And I think that a lot of these things, these partnerships come out of the needs of our community. And the thing about what we're able to do is have we call it nimbleness, or the flexibility to be able to, combine our forces and do the things that families need in the way that they need them. So I think that's been just a really great attribute of the work we've been able to do, and quickly get to pull together the resources that are needed.
Yeah, I think that's awesome, Josh. Often when we know like there's something going on with families, who can do this? Like who can pick up this? What was it? A giant box? Was it diapers? What was it? Was it masks, diapers?
There were like a bazillion wipes and I think diapers.
And they were like, somebody come pick them up. But like I got an email from Sheila, like, hey, let's coordinate this. And we were like, we're on it, we got it. And we, mobilize, and that's what we do. We're like, oh, us, we'll do it, we'll help. And that's tricky sometimes because we don't necessarily have the funding to do that. We've been chronically underfunded since the inception. So we'll talk about the funding piece in a second. So again, we have fatherhood, programs, perinatal programs, Building Strong Families Clinic. We started a grief and loss coalition because we knew that perinatal grief and loss was a gap in our state. And then Healthy Lamoille Valley, if there's folks who know more about that, I know that's a really great project for that whole county. But I'm gonna keep going because again, I'm not going to go over this. This is crazy. But these are our 8 core services. This is something that I developed and edited a bit, but COVID happened and it came out of nowhere. Here it is. It's on us. Things are shutting down. But you know what? The Family Resource Centers never shut down. Parent-child centers kept rocking and rolling. We kept providing our 8 core services. It looked a little different. And I just developed this comprehensive list of here's the ways that we kept serving families via our 8 core services during the COVID response period and into the COVID recovery period, which we are actively kind of, I don't know if we're straddling both of those. I'd like to be hopeful and say we're I don't really know, and I'm knocking on all the wood right now. So if you're interested in seeing this, I can get this to you. This is a really great list. We actually use this with our state reps and also sent to our federal delegation just to show like, here's the great work we're doing. Our doors are open and we are continuing to provide support to families. Again, this person, her name's Luna, she's wonderful. So you heard all about the parent-child centers. We rock. So our legislative ask, so one-time and ongoing funding. So as I said before, we are written into state statute and we have a line in the governor's budget. That budget line is currently funded at $3.3 million. That is for all 15 parent-child centers. And that allows us to provide those 8 core services and all of that great stuff that you saw in all of those previous slides, that nimbleness, that flexibility, the ability to serve families' needs kind of on a dime when things change in communities. That is able to happen because of the Parent-Child Center Integrated Grant. That really gives us a lot of flexibility to support families. So our ask, and I just put them big green blobs here, where our ask is for an increase in $1.5 million to that PCC integrated grant, that line in the governor's budget. We also are asking for an additional $3.7 million in one-time funding to support COVID response and recovery work. So last fiscal year, we received $3.7 million. We did a lot of wonderful things with that. Beep, there's a lot of those wonderful things. There's still so much to do. There's still families struggling. Again, we know that the human services kind of surge is still happening and upon us as families navigate continued COVID and the mental health challenges, the social, emotional challenges that are going to come out of COVID. So those are our 2 asks. So they're pretty simple. If somebody asks you, like, parent-child centers are awesome. They're written into statute. They've got a budget in the governor's budget, or they've got a budget line in the governor's budget. They've been chronically underfunded. They do all these amazing things. We want them to keep doing those amazing things. Please give them $1.5 million more. And then that 3.7 to continue with that ongoing COVID response and recovery. So that's our ask. And then we also have a bill. So the bill S91, we're already written in a statute. We opened up the statute. We wanted to make it stronger, hold us more strongly accountable to our partners. We wanted that continuity. We wanted to highlight quality. We wanted to put the standards in there. We wanted to ensure that people understood what it means to be designated as a parent-child center. How do you maintain that designation? What happens if somebody's struggling and needs additional support? So that's all written in there. It's making that statute much stronger than it has been previously. So we're not looking to create something new. This already exists. We're just looking to strengthen it. Part of this includes an auto inflator. So in there, we would get kind of an automatic increase on an annualized basis, which would be really important. So when we're talking to legislators, sometimes there's some confusion. Well, you want to pass a bill, but you're asking for this $1.5 million as well. We know that these are moving kind of at different speeds. So we want to make sure that for this next fiscal year, we're going to get that $1.5 million to continue to do our good work. And we also want support around the bill, and then to be able to have an ongoing increase in that budget line instead of going back to the well every year and saying, please, 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 which we will continue to do. We're all very happy to talk to legislators about the great work that we do. So that's the bill. And so just to give you a heads up on where it's at, it has was introduced. It was in Senate Health and Welfare. It got voted out unanimously 5-0. And so it now is out of that committee, and it will make its way to its next place. And then we were mentioned in the House Human Services budget memo for fiscal year 23. So that was really great. Our one-time ask, as well as our 3.7 million ask, were both listed in that budget memo. So that is where we're at. Whew, 10 minutes left. So this is our contact information, but we're going to leave it open for questions. I don't know how we did it, Josh. Good job. Enough
Nice
time
job, Amy.
for people to chat, ask questions, whatever you might need. Ask us anything. I see stuff in the chat, but I couldn't see it because I was sharing. Do you want me to stop sharing?
Yeah, you can pull down your screen share so everyone can see each other. There's no questions yet, but people
Take
can.
a screen grab of these if you need to get a hold of us. Josh and I love to chat, so about anything. Okay. What thoughts, questions, comments?
I would also just put out any other parent-child center directors that are here. If there's anything that you feel like you want to throw in, please feel free to do so.
Chatty group.
So can I just jump in and say, what an awesome presentation. I felt like I compiled all of the stuff that was going on at parent-child centers into something. I'd love to share it. I don't know if you're willing to share your screen pack and your voices, which was the exciting part. But you know, your focus on saying we're both universal and we also provide these targeted services for families that need specialized interventions. It just struck me how critically important that is, that you've created over these many years, a system that reaches all families where they need to be reached. So I just said, awesome.
Thanks,
Nice going.
Thanks for starting PCCs also. I can definitely share any of this information with you, and I have your email, so pop it over.
I just wanted to chime in and say that what I really love about them is I look at it as a one-stop shop for families, so that when they enter our door, we have such an array of services and support that they are then not having to call multiple different agencies to have the full circle, but rather just walk through our door and have their needs. And secondly, I love the PCCs in that we do what we have to get it done for families, meaning you know, if a family calls and it's not something we normally offer, I think I can definitely say we all kind of make that effort of, okay, we don't offer this, but I'm going to figure out how to make it happen. And if I can't, then I'm going to reach out to another parent-child center, or I'm going to reach out to another agency. But I don't think any of us leave a family hanging over the phone and say, sorry, I can't help you, which I'm really proud to be a part of.
A piece I'll add too of just that I think the one-stop shop idea is also that people come feeling welcomed and they still have their dignity. And I think that's really important, that people, it's hard to ask for help, right? I mean, it's like just go and say like, I need help. I don't have enough food, or I don't have enough, you know, I feel like I'm not a good enough parent, or whatever the thing is. But if I can walk out of a conversation feeling like I'm okay, and I'm not feeling ashamed of, all the pieces that aren't working as perfectly as I initially thought they were going to be as a parent. It's just I think it's something that we really put, we don't talk about it so much, we put a lot of attention into how we treat families and how, make sure that get their input, that their voice is heard. And again, it's the what, and it's also the how that I think is really valuable at parent-child centers. So.
I popped in here as a relatively new director of a parent-child center, in part so I could hear people who have been on the network longer discuss this phenomenon that is a PCC that's really hard to squeeze into a short presentation. So thanks, Josh and Amy, for taking that on for us. I feel like I always learn something in these sorts of sessions for when I'm talking about my own center. And I just want to emphasize a little bit more how important that universality is, that even people who don't think they need help, and here I'm speaking from personal experience because I was a parent participant at Josh's center long before I was ready to head up a different one in Milton. Just that you can think that you don't need support, and showing up there, you discover that you do. And that's because they are as open as they are, and everybody is welcome. And then the nimbleness piece. What we have up in Milton is so different from what I experienced in Burlington, and it's only a half-hour drive that divides where I live from where I work. And the support that I have from the network in tackling issues here in Milton, and the flexibility that I have to say, that model doesn't make any sense here. We have to do something totally different because we're dealing with families that are facing a really different set of challenges. I just feel like it's the best of both worlds for me as a director to have the network looking over my shoulder and offering those supports, and to have the flexibility to say, what we need right now is a support group for foster parents, because that's what's happening in vast quantity in Milton right now. So that's a very exciting part of our work, I think, too.
Yeah, absolutely. I think we should be really proud as a state of parent-child centers and how, we've built that into statute. We're part of the National Family Support Network. And those are folks like that entity works with national partners and sometimes folks outside of the country. And I often get emailed or called by the executive director to say, can you come to this event and speak about parent-child centers? Because it's, lots of people have family resource centers, but the way that you've done this, you've designed it, you've crafted it, the way that it works in your state is really, really awesome. And is something that, really can be a model for other states. And I think that that's really something for us to tout and really, these asks, the statute, the funding, like really wanting to recognize the value and the great model that we have in this state, and how do we foster that overall global health of the parent-child centers to ensure that they're here for families to be supported by ongoing. But I just wanted to note that there are other states around the country who really think this is a great model. How do we replicate that? So, kudos to Vermont for having such a great network. That is not me tooting my own horn. It really sounds like it. I realize it, but just yay that we have this in our state. All right, we've got 2 more minutes, and then you've got to pop into your next WOVA session for early childhood day at the legislature. So any last thoughts? Or people can have some time to navigate how to get to the next thing, which is a little tricky. Well, Josh and I really want to thank all of you for coming. And you do have our contact information, so please reach out if you have questions or thoughts or anything else that you might need. We are here for you.
I have one comment. I just want to say it's, early childhood day at the legislature, and we couldn't really get parents on board. I just want to thank April for bringing her little kiddo to the table here, and and representing who we're really talking about here.
Yep.
And so nice to have some little kiddo energy. So anyway, thank you guys.
Thanks,
Thank you, Amy and
everyone.
Josh. It's great to have you here. All right, so head back to your Whova agenda. The next session starts at 10:55. Thank you all for being here.